Newark District Parkinson's Group has been supporting Parkinson's sufferers in the Newark area for some time. Before coronavirus, we usually met on a Monday afternoon, which tended to be inconvenient for the people in employment. Coronavirus has caused us to review our plans and activities. This video is the third of three, aimed at employed people who are continuing in employment after a Parkinson's diagnosis. The elephants in the room is intended for the colleagues and even the managers of people who are working with Parkinson's disease. Hello, boys. It is the third part of the introduction to Parkinson's disease with a general theme that it's not just a tremor. No, Parkinson's is certainly not just a tremor. Parkinson's disease is rarely a drama, but it can often be a tragedy. Parkinson's disease will not cause a sufferer to collapse suddenly in the workplace. It will not cause a sufferer to slip into coma. There will be no dramatic medical alarms. But for the Parkinson's sufferer, every day can be a tragedy because people just don't understand what the condition involves. We know that Parkinson's sufferers will probably have hard to control tremors in the hands and possibly the face. And they might have some funny little finger movements that look as if they're rolling pills. Such tremors are part of a set of muscular movement symptoms called bradykinesia, literally the slow or diminished movement of body musculature. Most people believe Parkinson's disease, PD or Parkinsonism, is nothing more than some hard-to-control body movements. It's usually much more than this. But at least one of the bradykinesia symptoms must have been observed by the clinician for a case of Parkinson's to be confirmed in the first place. Once a clinical neurologist has confirmed that Parkinson's symptoms treatment can start, bradykinesia symptoms will usually respond within a few weeks or even perhaps a few days after starting treatment. So these usual symptoms that make Parkinson's observable to the general public are not usually the problem. In some senses, these are the least important symptoms in the longer term for someone with Parkinson's disease, as these are the ones most likely to respond to treatment. So what is Parkinson's disease? It is a long-term degenerative disorder of the central nervous system. It mainly affects the body's motor systems, musculature movements. But as it progresses, non-motor symptoms become more apparent. The symptoms usually emerge slowly, making early control difficult. There is no single definitive cause for the disease, but there is always a shortage of the chemical dopamine being produced by the substantia nigra part of the brain. This results in communication failures in the central nervous system. At present, there is no specific cure for Parkinson's disease, but dopamine replacement therapies are usually successful in stabilizing the condition. Symptoms occur in two very distinct classes. Motor symptoms, which include tremor, rigidity, slowness of movement, falls and dizziness, which can mean injuries if appropriate risk assessment care is not taken, freezing, which can mean the muscles literally freeze immobile. It can happen when standing up from a chair, walking through a doorway, or even when crossing a road. And muscle cramps and dystonia. This is when the muscles stiffen and shorten, which can result in pain and discomfort, and can be task-related. These symptoms usually respond well to correct treatments. But a second distinct class is a much longer list, and non-motor symptoms include low blood pressure, bladder and bowel problems, restless leg syndrome, fatigue, sweating and skin dampness, sleep disorders, eating, swallowing and saliva control, speech and communication control, eye problems, foot care issues, impulsive and obsessive behaviors, lacking in energy, mouth and dental issues, memory and thinking problems, anxiety, hallucinations and delusions, depression, apathy, dementia, and general pain and discomfort, and this can be severe in some cases. So it's not just a tremor. These symptoms are more difficult to control because they occur unpredictably. However, it is highly unlikely that anyone will suffer all of these symptoms. It is unusual to even suffer all of the motor symptoms. Most of the symptoms will respond well to treatment. There is no reason to expect these symptoms to be totally debilitating. But it might be best for employers to know about the condition and its effects. Together, you might want to restrict some of the activities where the risk is high. An employee with Parkinson's will know the risks they run and how to deal with them. The main thing is to understand the pressures caused by the condition. Your work colleagues will develop coping strategies to cope with the illness. It would help if you could support these. Talk with your colleague and see if there are ways in which you can help them specifically. A typical symptom of Parkinsonism is the loss of facial expression. This is sometimes referred to as Parkinson's mask or frozen face mask. Try to remember that having to concentrate can lead a PD sufferer to a totally emotionless and disengaged body language, conveying boredom, disinterest, or even annoyance, when this is not at all what they are experiencing. In extreme cases, a Parkinson's sufferer can think they look like this. But in fact, this can be the frozen mask image they are conveying. It's only a look. It's not what they feel, so be kind. Explain to them how they look. If you're worrying about how people with Parkinson's disease can cope with the pressures of employment, here are a couple of stories that might help. You might recognize at least one of these people. The first one is Michael Rich Clifford. He was an astronaut with NASA who flew 3 space missions in December of 1992, April of 1994, and again in March of 1996, and this last mission included a 6-hour spacewalk whilst docked on the Russian Mir space station. He then left NASA in January 1997 to join Boeing's Defense and Space Group as their flight operations manager. He was diagnosed with Parkinson's disease early in 1994. The shuttle commander for the 1994 mission knew about the diagnosis but kept it secret until after the mission, and he then went on to fly another mission that included a 6-hour spacewalk. The other character is Sir William "Billy" Connolly, a successful and remarkably talented Scottish stand-up comedian, who is also a successful playwright, actor, presenter and painter, and he is still popular in many guest and TV appearances on radio chat shows. But since 2013, Connolly has been travelling and performing with a joint diagnosis of Parkinson's disease and prostate cancer. And at the time of this programme, he's still going strong. Is the work we are doing for you more pressurised than this? Research shows that Parkinson's is a degenerative disease. It proceeds by stages. Disabilities will worsen in time. The degeneration from one stage to the next does not have a set timetable. Some people deteriorate more quickly, others take it slowly. And some of the symptoms at a stage may never appear at all, when symptoms of the next stage do appear. Research to find a cure is going on continuously and is worldwide. Treatments are also being continuously improved so that existing sufferers cope with some of the symptoms more easily and with less discomfort. Physiotherapy can also help to keep the joints and muscles as flexible as possible and to quickly recover after falls and mishaps. What has research shown already? Parkinson's is a condition that affects the brain. It occurs when cells that produce dopamine die, but we don't know yet why they die. When the supply of dopamine chemical to the brain is reduced, movement disorders follow. An immediate treatment is for dopamine replacement therapy to be introduced. But the supply of dopamine has to be properly balanced and regularly taken. With proper and controlled treatment, there is no reason why people with Parkinson's disease cannot reach the peak of their performance and of their careers. And you can help. The Newark and District Parkinson's Group provides direct support, practical advice, and emotional protection for local Parkinson's sufferers, their colleagues, and their carers. For both sufferers and the colleagues of people with Parkinson's disease, our mission is to make the situation better. Anyone and everyone is welcome to join us. You don't have to have Parkinson's. You don't even have to care for someone with Parkinson's. You just have to care. Local support and national research. If you want to know more about what we are doing, or if you have any concerns about working with people with Parkinsonism, send your contact details to hillkey@btinternet.com. Thank you for watching this video. We hope it's useful and we hope it will help in the future. Goodbye now.